So we are going live, people. Okay, I'm going to start the webinar. Okay, good evening, everyone. Welcome to the, let's see, welcome, let me get my slides right, to the November 9th, 2021 Community Vaccine Advisory Group meeting. Oh, is my computer freezing just as this happens?
Queremos darle la bienvenida a todos a la reunión del 9 de noviembre del concejal de la comunidad.
My computer has frozen, but it sounds like you can hear me. And once it unfreezes, I will.
We need to be set up for the interpreters.
Yeah, I didn't want to happen. Come on. Ben, are you able to take over in any way?
Yeah, let me pull up the slides real quick.
I'm really sorry. And then you don't have interpretation though, access. My computer is literally frozen. I can't believe this.
Estamos haciendo problemas técnicos, entonces vamos a esperar.
Can't get to anything on my screens. Can you still hear me?
Yeah, we can still hear you.
I can't touch a single thing on my screen. It's not letting me do anything. Does Unreal. Unreal. All right, I'm gonna have to come back. I apologize. Shoot. Maybe you guys can just kick off and introduce.
Do you have someone, if you'd like to make me co-host or co-host, maybe I could set up the interpretation while you reboot?
If you're able to log in through Anika's.
Okay, yeah.
Yeah.
There we go.
Oh, really?
Yep.
Okay. Okay, jeez. Of course. Okay. Hello and welcome. I apologize for the technical difficulties. My name is Lauren. You're now here at the November 9th Community Vaccine Advisory Committee meeting, and we have live interpretation in Spanish and in American Sign Language. If you would like to listen to the meeting in Spanish, please select the globe at the bottom. If you are listening in English, please also select the globe at the bottom and choose your language. Could someone make the announcement about the language, and then I'll start, please.
Hola, buenas noches. Bienvenidos todos a la reunión del concejal de equipo de vacunación de la comunidad. es la del 9 de noviembre del 2021. Queremos que sepan que tienen la opción de escoger su idioma para esta sesión. Por favor, pulsen el globo terráqueo al fondo de su pantalla y seleccionen el canal que desean escuchar en español para quienes hablan español. Y para los que hablan inglés, por favor, también hagan clic en el canal de inglés.
Thank you. I will hit start. Okay. Also wanted to announce that for those of us who are on, YouTube, we are only able to share one video screen at a time. So only the sign language interpreters will be displayed via live stream. And we apologize for that. And you'll be able to hear the speakers. Other than that, we also have closed captioning. And so I hope that you will enable that if you want to use it. And I believe those are my announcements. The final one is just to remind our presenters to speak slowly for our interpreters. Thank you. I'll turn it over to Greg, I believe.
Yeah. Good evening, everybody. Thank you, Lauren, and all of our folks on the back end of this to get things set up. My name is Greg Hodge, and this is the Community Advisory Group meeting for November 9th. I want to welcome everybody to the call on behalf of Nestor Castillo and Kimmy Watkins-Tart, who are my co-chairs. If you are a new participant, I'm going to invite you to put your name and organization in the chat, so we can meet you that way. We want to take a moment to acknowledge the land that we're on, and it's not just a thing that we're doing just out of habit now. It's something we really care about, that we are on Ohlone country, unceded territory, as all my relations would say, that causes us to be reflective of where we are, who we are, and how we're connected to our Native American brothers and sisters. The other thing that we want to do, and I think there's a photograph, Lauren, if you could pull that up if you have it. We want to acknowledge our ancestors, and we always take a moment to think about the people who came before us, people who did work in this community. And one of the people that is on our mind and on our hearts right now is Supervisor Wilma Chan, who passed away last week as a result of a accident where a car ran into her as she was walking her dog. Supervisor Chan was the first, in many ways, she was the first Asian American woman to serve on the County Board of Supervisors. She was the first Asian American woman to serve as the majority leader in the assembly, as I understand it. She served on the school board in the early, I think probably in the early 80s. But Wilma was a fixture in this community, and in a good way. She was a constant champion for children, for working families, for immigrant families, and for vulnerable folks all over the county. And so I thought we had a photograph of her. I'm not seeing it come up, but maybe at some point we'll see that photograph. But I want to just take a moment of silence for our friend and colleague, Wilma Chan. All right, thank you all for that. So we had a busy, full agenda this evening, and we want to make sure that you put suggestions for future topics in the chat. That tonight we're going to hear some partner updates in a few moments, starting with Dr. Misha Burns and Umoja Youth Mobilizers. We'll get an update on the epidemic and kind of where we are, and to spend a bit of time thinking about a hyperlocal vaccine campaign. And then we'll have a deeper dive on how we want to reach Latinx and African-American groups. And then we'll end our conversation this evening with a presentation from the DOOR program. And we have a few guests who will help us with that conversation. So I think now we are ready, if they're on the line, and I can't quite see gallery view to know who's on tonight. There we go. Then we're going to hear from Dr. Misha Burns and Umoja Youth Mobilizers if they are on the call. Dr. Burns, I see your face.
Ashe. And good evening, everyone. Thank you all so much for allowing the opportunity to be here. As Greg has said, I'm Dr. Misha Burns. I used to be the Policy and Advocacy Manager for World. I am now the Policy and Advocacy Consultant, and then also the founder of PIT Solutions, Perfect Imperfections, um, Toolkit and Training Solutions. And one of the big things with World came about in 1991 amidst the HIV/AIDS epidemic, when there was a time where it was considered a gay white male disease. And so for that, World was founded for women to have a safe haven that had been diagnosed with HIV, that had been diagnosed with AIDS when it was still taboo, although it is still taboo now, but to be able to have a safe place. And so when it initially brought up, it was to improve the lives and the health of women and girls and families. And when we say women and girls, we also include cis and trans, or those of trans experience, who were affected by HIV through peer-based education, wellness services, advocacy, and leadership development. Understanding that um, our lives didn't stop because COVID-19 started, and then also our lives are beyond HIV or a diagnosis. And so understanding and putting it into mainstream, the same as if somebody was diagnosed with diabetes, if someone was diagnosed with high blood pressure or anything of the sort. And so the vision behind it is a place where women, girls, and families would have the tools, support, and knowledge to live healthy and productive lives with dignity. One of the big things is understanding that you don't know who is HIV positive. You can't look at someone anymore the way they used to be able to and say, oh, I know what your status is, because you don't. And so that's one of the big things that World, was set in stone to be able to do, to really just be able to, whether you were a doctor, whether you were a teacher, whether you were a mother, a sister, whatever the case may be, there's so many different labels that are out there that women and girls wear that often was pushed under the background. So that was one of the biggest things and the premises behind World being established, and then being able to lift up those things that had been pushed under the rug. When COVID-19 started, a few things that World did was automatically pivoted, because we also knew that the disparities that were happening before were not going to stop because COVID-19 started. And so immediately the work turned into, okay, although we may not be in person, we had the pantry that was set up, and so immediately our peer advisors, they were able to deliver food, or deliver it to the door, have somebody pick it up, so that people can still go on and living their lives. Support groups, they changed to going virtually. We also understood the impact of mental health, and so with that, it was the ability to then, hey, let's incorporate some physical exercise, let's incorporate being able to talk weekly, even though we may not necessarily be able to be in person. What does that look like? And so that has been something that has continued on. And the women that go through World, and the girls, everything from press conferences to writing op-eds to attending different conferences to building up the community the way it is, and breaking down that stigma and the taboo that HIV, AIDS, and various STIs, have brought up. The mere fact that once someone has been diagnosed with the STI, they are more susceptible to contracting HIV and AIDS. So being able to look at that and educate, also
Hey,
prevent.
Demisha, I'm gonna
Yes.
ask you to slow down just a little bit
All
for
right.
our interpreters and our ASL folks, because you got them going real fast.
I'm
So
sorry.
slow down just a little bit. Thank you.
All right, no problem. Awesome. And so just basically just running it out, just continuing with the fact of, we want to make sure that we're continuing the conversation. We want to make sure that it is not just something where people are still looking at saying, oh, okay, well, it's those people. It's not those people. We are the face of HIV/AIDS. We are the face of STIs, and STDs. And it is something that as a whole, we have to address, because the only way through it, just as we talk about with COVID-19, is united. And so the mere fact of, we have younger and younger individuals who are being diagnosed with HIV and AIDS. We have the elderly who are being diagnosed with HIV and AIDS. And so we don't want to put it on a particular age. We don't want to put it on a particular dynamic, but understanding that these are various things that are going on, and these are various areas that need to be addressed, because it is something that cannot be overlooked. It is something that cannot be pushed under the rug. And it has happened for so long, and World has made a statement of, it's time to shut that down, and it's time to really just elevate the various things that are going on. So with that, some of the things that I'm about to say, World connects with ETE and then the epidemics. And so that is on the California level with regards to just addressing the various things that are going on. Uh, World is also a proud partner with Emoja. And then some of the things that are happening now, currently hiring for a case manager and navigator, and a program director. And then as well as there's a community event on November 18th at Mosswood Park that will be having HIV testing, as well as COVID and the flu vaccine. So just some things that are happening with World. And then for more information, we would love for people to go to the website, www.womenhiv.org, Facebook at Women HIV, Snapchat at World Oakland, and then Instagram at Women HIV World. Thank you.
All right. Demisha, thank you so much for that. Appreciate your work. Appreciate your sharing that work with us. We now want to hear from the Umoja Youth Mobilizers, and as someone who's been designated to speak on their behalf this evening.
Hi, everyone. I'm Sahar. I co-lead the Youth Mobilizer program, and I am happy to be here today to talk to you guys a little bit about what we've been doing. I'm just going to give you guys a quick update, and I'm going to share with you a mock-up of our recent FAQ card. So we have gathered the relevant frequently asked questions for our FAQ card. Here is a version that we have been looking at. Can you guys see my screen?
Yes, we can.
Okay, great.
It looks beautiful.
Yeah, thank you so much. So at the top, it says Umoja Youth Mobilizers. So this is a FAQ card, and we wanted to make it interactive. It looks really cool. Lauren is on the front. I hope you don't mind, Lauren, but you look great.
Thanks.
So on the back of the card, we're going to have a QR code, and the QR code is going to be linked to a working database of frequently asked questions about COVID-19 vaccination that all of the youth mobilizers got together and kind of decided what questions we think people are asking or are the most important to be answered. And this is a working database. We can always add more questions as things change because this virus is changing, new things are happening. So we want to account for that. The link will live on a tab that is connected to the already up Umoja Health website. So it will be easily accessible, and we are excited to get that out. The second update that I have for you guys is about our skit. Here, I can stop sharing this. We have finalized our skit, and we're excited to share it with you. I will not be doing that today, but just for a little background, it is set up as a boxing match between COVID-19 and someone who is initially unvaccinated and then decides to get vaccinated. It's going to be a short animated skit that will be done by Noise Filters, and we're excited to send that over and then share it with you guys soon when it's done. The last update that I have for you guys is we are super excited because Umoja Health Youth Mobilizers are going to be on air during a 15 to 30 second radio slot on a bunch of local radio stations. We will be sharing a short PSA about vaccination, and something we've been doing to kind of get a sense of what we want, what direction we want to go with the PSA is we've been in our meetings sharing some personal stories that we have had surrounding COVID, surrounding vaccination. So one thing I thought would be cool is to have one of our youth mobilizers share their personal story with you all today. And that is Katrina Edwards. Would you like to share, Katrina?
Yes. Hi, everybody.
Hi,
I'm Katrina. I go by Trina. So I'm gonna share my skit with you guys. So when the vaccinations first came out, I worked as in property management in San Francisco. So all the employees were really pushed to get the vaccination just for, the safety of everybody. And in my household, I was the only vaccinated person. And my brother, he's in his 20s, and he likes to go out a lot and party and hang with friends. And he was really against the vaccine, along with some of my other family members. But like I said, he likes to go out and party a lot. So he came back home and he found out he had COVID, and we were all scared because my grandmother is fighting cancer and she's not really supposed to be around anything too crazy. And then I have a sister who has Down syndrome, and we're very, very, very safe over her. We're crazy over her. So my brother decided to go get vaccinated just to keep the family safe, because he know if anything bad happened, it would kind of be his fault. So that's what pushed him to get vaccinated, and the whole family decided to get vaccinated after that scare.
Thank you so much, Katrina, for sharing. So that's just one of the stories. We shared a bunch of stories, and it kind of gave us a good sense of where we want to go with the PSA. That's all I have for you guys today. As always, we really appreciate your feedback and input. So feel free to send me any messages in the chat about anything that I talked about. But thank you so much.
Cool. Thank you, both Trina and Sahir. We have time for maybe one question. If anybody's got a question for our youth mobilizers. I've got one quick one, Trina. First of all, thank you for sharing your story. With regard to your brother, now that he's been vaccinated, is he also talking to his own friends about what his hesitation was and what caused him to get a vaccine?
Yes, actually, yes. One of his close friends had called him and told him that he was COVID positive, in which he gave it to my brothers. So they all actually got vaccinated after that, because they love to hang out. They're always out.
Yeah. Well, thank you so much for sharing your story. And Sahir, thank you as well for the frequently asked questions card. We're looking forward to hearing those spots on the radio. We're going to move to our next item, and I'm going to turn this over to our wonderful and fabulous director of our public health department, Kimmy Watkins-Tart. Take it away, Kimmy.
Thank you. And thank you, Sahir and Trina, for sharing what you're working on, as well as Dr. Misha Burns. We're always glad to hear about all the work that's going on in the community. Actually, I'm not presenting in this segment. I'm just facilitating the presenters. And so I think that Chuck McKetney and Donata Nilsson are going to provide a COVID update for you all. And I think Chuck is up first.
I think you're on mute, Chuck.
There we go. I'm the director of what's called Health Services Informatics for the Alameda County Public Health Department. And today I'm going to have just a brief snippet of some of the information about COVID currently. If we could move to the next slide. Currently, since the summer, we have been seeing a decline in the case rate for COVID across the county. That decline is slowing now, and we are beginning to see some flattening of that line, which suggests that the number of cases is steady and low. We've also seen some indication that we may begin to see an uptick in COVID cases during the early part of the winter. We have seen over time a reduction in hospitalizations and ICU hospitalizations in the county, which is great. It's a really good indicator of how many people are very sick from COVID. Can we go to the next slide? Overall, inside the county, between July and now, we've increased the amount of testing that is happening inside the county. We have over 10,500 tests being done a day across the county. That includes places like Kaiser and Sutter, as well as the work that we are doing inside of the public health department. So we're happy to see that a good number of tests are continuing. I would briefly say, though, that we also are beginning to show a lot of activity with regard to boosters. A significant portion of our population is beginning to receive booster vaccinations. So that's my part. Thanks again, and I will turn it over to Donata.
All right. Thank you, Chuck. So I'm going to talk a little bit about the masking mandate. So basically, we have been easing the masking requirements for fully vaccinated people. So vaccinated people may now remove their mask in some closed settings. And I believe there is another slide on that, but just for this specific purpose, this is particularly applicable to some office settings, as well as gyms, religious gatherings, and organized gatherings. So the requirements are that every individual needs to be fully vaccinated, that there's no more than 100 individuals present, and that the space is not open to the general public. Also, masks are still required indoors for all other public settings, unvaccinated people, K through 12 settings, so basically our schools and public transit. On the next slide, actually, I think I'm gonna go ahead and skip this slide and go to the following slide. Thanks. Additionally, right now we have a vaccine available for 5 to 11-year-olds. And this is following the FDA's emergency use authorization and the CDC's recommendation. The pediatric dose is 1/3 of the dose given to teens and adults. Like other older age groups, and the 5 to 11-year-olds also must get the 2 doses at least 3 weeks apart to get the maximum protection from the vaccine. The vaccines are also available for free to every person aged 5+, regardless of residency or immigration status. And existing Alameda County supported clinics will provide vaccinations for this age group by mid-November. So we're planning on having vaccine available at our community pods starting, I believe, November 19th and 20th, and going on forward from there. So we are going to continue our weekend hours and our evening hours to accommodate access for working families at those sites. On the next slide, it's just a reminder that COVID-19 boosters are really important for, especially for individuals who are age 65+ or 50+ with underlying medical conditions, because they are most likely to experience severe disease, hospitalization, and death from COVID-19 infection. Dr. Moss has really emphasized this importance for individuals 65 to get their boosters, especially over the holidays as people begin to gather with friends and family over the holidays. On the next slide, I just wanted to give you a quick update what our community vaccination unit in our COVID division is still focusing on: long-term care facilities. So we're really, again, focusing on providing boosters to long-term care facility residents. Again, as the holidays come upon us, people will be visiting their residents in long-term care and other congregate settings, and we want to make sure they are protected and get that booster shot. We are also using any of our contracted providers to assist us with that effort. So far, we have received 225 requests for long-term care facilities. 203 have been scheduled, and we've completed 51, so we're well underway to protecting those residents. We're also working on co-administrating flu vaccine. So our immunization program under our public health department has provided flu vaccines to those contracted providers so they can co-administer flu vaccine with a COVID vaccine. For the 5 to 11-year-old, we are working very closely to contact all of our pediatric providers in our county so that they can have access to pediatric vaccine. And at this time, we have over 30,000 vaccine vials available in our county, and about 58 pediatric and other providers that are able to provide vaccine in the community. We are, as I mentioned, we'll be providing vaccine starting on November 19th at our county pods. And we are also working with very specific schools. Right now we have 9 schools prioritized for doing centralized clinics for the 5 to 11-year-old age group. And then we're going to be providing additional support for specific target schools where they have the lowest vaccination rates. So that's what we're working on in terms of the 5 to 11-year-olds. And then finally, the next slide is just a reminder that on our county website, we have a calendar of pods that are available to the public. And when you go there, we always keep this updated. You can click on these sites and it'll show you what vaccines are available at each of those locations. And I believe that is the last slide for the COVID update with a focus on vaccine today.
Thank you, Donata. Greg, can we pause for a few questions here?
Yes. Yeah, that would be great.
Okay. Do we have any questions?
I believe Wendy has.
I have a question.
Yeah, Wendy, go ahead.
Yeah. Hi, thank you. Thanks, Donata. I'm curious about the messaging in the long-term care facilities about what version of the COVID vaccine they're receiving, and whether, you know, because it appears that it's okay if you got Moderna, it's okay to have Pfizer and vice versa, but do you have some clear messaging that you use so that people who are concerned about mixing and matching can, you know, get the information in a clear way that will help them say yes?
Yeah, that's a great question. I think Joanna Locke is on the phone too to help answer some questions. But as far as we do have some talking points that we specifically use at our pod site, so people can make an informed decision if, you know, whether they want to mix or if they want to stay with the original the original vaccine that they received. For our long-term care facilities, I know we have all 3 available. So I'm not exactly sure, to be honest, how they're approaching that, but I think they're just probably going with what, you know, originally they had received. But I don't know if Joanna has anything else you'd like to share regarding that?
I don't have any additional information about the long-term care facilities, but I think we could reach out to maybe David and try to get an answer about that and get back to you.
It would be useful, yeah, so that we can have with providers that are interacting, that are visiting, for instance, so they're all on the same page.
Absolutely. We'll get back to you, Wendy. Thank you for the question.
Thank you.
I think I saw another
From Pastor Arlene. Good evening. How you doing?
Hey everybody, hi fun people. I miss you.
Hey, miss you too.
Hey, I guess 2 things. You know, we're not only working on vaccinations and trying to help everybody get vaccinated, but we also are an employer. And I'm wondering, you know, if there's any guidance being formulated yet with regard to the booster and policies for employers regarding the booster. Okay. And then I guess sort of related to that is, you know, are we going to just keep calling everybody fully vaccinated if they just had the 2, or is fully vaccinated going to be including the booster here one of these days?
That's a great question. Thank you. And I think I'm going to go ahead and give this to Joanna.
So the CDC currently has not changed the definition of what it means to be fully vaccinated. And they have not indicated that that is their plan. We'll have to see going forward if that changes. I have heard in other countries that may be slightly different. But here, right now, it's, if you had 2 doses of Pfizer or Moderna, 1 dose of J&J, you are considered to be fully vaccinated.
It's complicated, I know. Yeah, thank you. And then just, this isn't a question, but just a comment, we're coming upon some big holidays in the faith communities. And I personally found the special Zoom sessions that we had with Dr. Moss really helpful, especially as we were entering into the Advent and Christmas and season last year and so forth. It's not, yes, we're having those holidays again, and yet, it's a different day. It's a different time. We have a vaccine. We also have variants and so forth. So be super helpful, to have a word from public health for the faith communities. Thank you.
Got a comment and question from our good friend, Dr. Kim Rhodes. Hey, Kim.
Hey, everybody. Sorry I'm late, but I heard the youth mobilizers did great. Delayed clap for them. I was wondering what we're supposed to be telling people, and I'm, this is dog with a bone, but if the interval for J&J booster is 2 months, then what is the duration or durability of that second dose? And do they need to continue to do it 2 months?
So the CDC hasn't weighed in on that yet, but it's a good question. So whether or not a booster will be needed after that, I think we don't know yet. I know that, that will be sort of ongoing data collection that will then inform kind of the next step, right? So they released the vaccines and then realized we were going to need boosters. And now, after the next round of data collection, figuring out, will we need one every year, or kind of what that will look like in an ongoing way.
Right, but I'm not really asking a booster question. I'm specifically asking about J&J because the duration is so different than it is for Moderna and Pfizer specifically. And then I guess my other sort of question is, one of the FDA's comments was for J&J was, you really don't have enough evidence to say this is a booster. This looks more like it should be a second dose. That was in the formal comments. So what I'm asking about really is about J&J, not about like, will we need a shot every year? Because we might, that's fine. But J&J's interval is super duper short. So we have a bunch of people who got vaccinated in March and April who are like needed a second dose like yesterday. So I'm worried about them. And then the other question that I have just as a provider is, are we giving them a booster? Like if they choose Moderna, do they get a half dose, a 2.5 ml dose of Moderna, or do they get a full 5 ml dose of a 0.5, sorry, of Moderna? Do you understand what I'm saying? Like I'm asking, is it a full dose that's their second shot, or is it a booster if they're going to get one of the mRNA vaccines?
Yeah, so I think there were definitely people who felt that the second dose of J&J was really the second dose in a primary series, but it was not authorized in that way. That's not what they ended up calling it, although I think that may shift over time. So we use the booster language because that's the booster in the authorization. And yeah, as far as I haven't heard anything differently around Moderna full dose being used for those who got J&J, because the second dose after J&J is still considered a booster, you get the half dose of Moderna. That's exactly what I did. I had J&J first and I got my Moderna booster and I got the half dose for booster. So whether or not in the future, I agree with you that people that got J&J in the spring need a second dose of something, and whether or not eventually it will be called, that will become a 2-dose vaccine, I think is up in the air. But right now we call it a booster because that's what's in the EUA. Does that answer your question?
Yeah, Thank you so much, Dr. Joanna Locke, for joining us today. Joanna is our clinical guidance lead and works closely with Dr. Moss, so we just really appreciate you being here today to answer these questions.
And I have a question, Joan Edelstein with the Alameda County School Nurses, just as far as access for the information on the community clinics from the Alameda County Public Health Department website. I don't see the clinics listed on the clinical list at the County Health Department. I'm just wondering where on the County Public Health Department website people can access that information.
The clinic locations, is that what you were asking?
Right. We have the link to what all the clinics are, which is fabulous, and we can certainly share, but I'm just wondering when people go to the Public Health Department website, how they access through the website if they don't have this link.
So, I mean, if you go to the main site, you go to the vaccine page. And it's there, it says vaccines by date. And it should
For the
be
for the COVID vaccine.
Yes. So so if you go to the main webpage, to our homepage, then on the left side, it says COVID-19 homepage, and then you can click on vaccine. And then you can click on vaccine locations, and it says where to get a vaccine.
Okay, thank you very much.
Absolutely.
All right. I think, Kimmy, I think in the interest of time, maybe it's going to go to our hyperlocal vaccine campaign with Toure.
Yep. Toure, yep. You're up.
Okay, good evening, everybody. I will make this quick because some of the slides we have already seen. So I'm happy to share with you an update on HCSA's hyperlocal vaccination campaign. This is a slide that we've already shown. That's really our values and operational principles for the hyperlocal vaccine media campaign. Next slide, please. So again, I think what's important that I want to reiterate, also this slide I shared at one of the last CAGs, is that this campaign is part of the larger vaccination uptake ecosystem within the Alameda County Healthcare Services Agency that includes all of the things that we have been talking about in these meetings. You'll get some information from our door partners. We have health educators, community navigators, social media posting, folks that are doing the health education at our testing and vaccination sites, just many, many things. So this is one part of a large effort. Next slide, please.
Sorry, here I go.
That's okay.
Okay.
And again, this is another slide that has been shared. This is really showing the feedback loop for our messaging campaign. Our campaign will be launched, we anticipate next week, and the content will be refined in real time through audience engagement and then ongoing engagement with our stakeholder groups, many of whom we have worked with to refine the messaging campaign. I just want to give a real shout out to the Emoji Youth Mobilizers and all of the other groups who supported the feedback sessions to help us with message refinement. And we're really excited to show you some of the creative today that we're going to be moving forward next week. Next slide, please. So this again is the quantitative and qualitative context from which we continue to iterate our and change our campaign based upon the data that we use across all of our vaccination efforts. So these numbers have been most recently updated, and the following audiences and neighborhoods that you see in the sub bullets are what we're working on for hyper local targeted messaging. And we're working with our media buyer to outreach specifically to these particular residents in particular neighborhoods. Next slide, please. So this represents a shift in our creative after doing feedback sessions with over 60 stakeholders. We have refined the campaign to 2 focuses: keeping it real, which is really focused on statistics and informed decision-making. And then really like the story that Trina told, getting to the heart of the matter, the social relationships that encourage people to get vaccinated. And so that's the Counting on You campaign. So you can see examples of the creative that will go out. Next slide, please. So I wanted to include this in today's presentation because this shows you the breadth of the hyperlocal vaccination campaign. We'll be doing digital ads that's similar to the creative you just saw, buying some time in Spanish language television, over the top television, and there's definitions on the left there, streaming audio, ethnic media, which will be in language, and then some out of home, some of which might be in kind. So these are all the different places where we will be placing our creative. And I said before at the CAG that for some folks, this will be a largely unseen campaign because it is so specific and reaching really, as our HCSA communications director, Jerry Randup says, the treetops. So folks who are still debating whether or not to get the vaccination, and it's really looking to help shape their decision-making. Next slide, please. So current status, we are finalizing the creative this week. The campaign will go live next week. And again, the duration of the campaign will be about 6 to 8 weeks. And we will be following the data. It is the North Star for what we're doing. And we'll follow the data. Maybe, things will shift and the campaign will go shorter or longer. So the next step is to do the out of home media, so billboards and radio. And again, ongoing refinement is really the key marker of what we're trying to do with this campaign. And I also, as a segue into the next section, want to really give a lot of thanks to all of the qualitative information and quantitative information we've received from multiple sources, including our community navigators, our door partners, and then you'll see in much more detail the vaccine attitude survey that was administered by our public health department. And we took information from all of these sources to really shape our creative in this campaign. So much gratitude to the many, many inputs and many hands into this effort. So thank you for that. And I believe I can turn it over back to Kimmy or Greg.
Yeah, Kimmy, and any other questions, comments before we move to the next part of our agenda? Thanks, Ray. Let's then move into—
I have a question.
Oh, sure.
Sorry, I didn't raise my hand. I'm just curious first of all, thank you for your work and to all of your colleagues for the incredible work you're doing. It's incredibly important and just really, really appreciate it. I'm curious to what extent the efforts that you're presenting today are coordinated with the Alameda Alliance and their efforts specifically targeting Medi-Cal patients.
Yeah, thank you, Joe. That's a great question. Certainly, we have been in communication with the Alliance around what the work is that they are doing and supporting their efforts, sharing our strategies, and really noting that there is overlap in the populations that we're looking at. So we're in constant communication and really endeavoring to coordinate with them on that. And Nitu, I saw put in the chat that Terry Lightfoot, who's supporting the effort for the Alliance, he's in this meeting actually. So Terry and I have been in communication. Thanks, Joe.
Thanks, Joe.
I wouldn't be doing my job with systems integration if we didn't attend to that.
All right. Any other questions? If not, I think we're ready to go to a deeper dive in terms of reaching our Latinx and African American folks. And I'm going to turn it over to Dr. Ayala and Donata.
Good evening, everyone.
Hey, George.
How are you today? I'm so happy to join you again. This is part 2 of a presentation that I had the good fortune of sharing with you the last time we met. And it's really an effort to kind of understand more deeply the beliefs and attitudes held by folks who are disproportionately impacted by the COVID-19 pandemic in Alameda County. And I'm happy to tell you that I'm being joined by Dr. Liz Maker for this presentation. Next slide, please. As you might recall, I shared a similar table with you the first time I spoke with you. Here's a slightly updated table. We're at now close to 1,000 respondents. We've highlighted here for you African American, Black respondents, and Latinx respondents who we will kind of focus on for today's talk. Next slide, please. I want to remind you also that there are important demographic differences between vaccinated and unvaccinated survey responses, so much so that we decided to kind of look more deeply at those differences. But before we go into that, I wanted to share with you that there was a higher percentage of vaccinated respondents who were Asian or white, female, and took the survey in English. There was also a higher percentage of unvaccinated participants who were Latinx, younger than age 18, living with more than 4 people, and had not been to college. Few unvaccinated answered open-ended questions in the survey, and as you might recall, we gave people a chance to answer questions in an open-ended way. And then fewer gave demographic data. Fewer unvaccinated folks gave us their demographic data. Next slide, please. I also shared with the group these 2 slides, and here, and this is just a reminder of some of the things we asked in this survey. We asked in the survey about what influences their decision-making, and we looked at that by vaccination status. Here I put side by side Black respondents and what they told us about what influences their decision-making, next to Latinx respondents and what they told us. In orange, those represent the vaccinated respondents, and in blue, unvaccinated. And as you can see, there's differences across the different kind of possible influencing factors, and also some differences between how Black respondents and Latinx respondents, what they told us about what influences their decision-making. For example, confidence that the vaccine is safe seemed really, there was a very, very big difference between vaccinated and unvaccinated folks. But for Latinx, there wasn't really a big difference between vaccinated and unvaccinated when it came to the level of confidence that people felt in terms of how safe the vaccine was. And being able to get the vaccine for free, there was a big difference among Black residents between the vaccinated respondents and unvaccinated. Whereas when you look at Latinx respondents, there wasn't really a big difference between the two. And I'm gonna go down to the bottom. You'll see that when it comes to other people in your community getting vaccinated as a possible influencing factor, there seems to be a big difference between vaccinated and unvaccinated among Latinx respondents. But the differences among Black respondents in terms of the response to that question wasn't very big. It wasn't at least statistically significant. Next slide. In summary,
Sorry.
I'm sorry, go ahead.
Oh, go ahead.
In summary, we found substantial differences between vaccinated status and by race and ethnicity. Respondents reflected a broad range of concerns that could be summarized in 5 main categories. The first is distrust or trust of government and vaccine promotion, facts, for example, safety, effectiveness, and information, factual information about the vaccine. Principles or values, for example, people have a responsibility to get vaccinated was something that we heard, and it got reflected in the survey responses. Access, getting appointments easily, having vaccines offered in convenient places, getting it for free, situating vaccines in businesses, and getting ready for businesses and schools to get opened. And then collectivism, getting information from other trusted sources, other people in the community getting vaccinated, and concern for family and friends. And these areas were discerned from both the quantitative and qualitative findings, and the findings should inform how to segment audiences and to tailor our messages about COVID-19 and vaccines moving forward. I'm going to pass it on to my colleague, Dr. Maker, who will kind of take us through some of what people said. And we're going to take a deeper dive here. Next slide, please.
Thank you, George. I'm so happy to be sharing this information and all of what I've heard in the meeting so far about the different messaging getting out there. For making the decision to get the vaccine, the issue of trust or distrust did come up quite a bit. And for people who decided not to get a vaccine, distrust of the government, doctors, and COVID information came up commonly, and it ran the range of people thinking, there's something not quite right. Like, because I see some people are still getting COVID, even though they've been vaccinated, and some people who are looking at it more like a plot or a deliberate deception, like this gentleman, the quote from the gentleman who thought that whose wife told him it was an economic reset. Then also we asked people who their trusted messengers are, and George and I wanted to point out that Black respondents said that they trust faith communities, which looks like a good resource for messaging. Next slide, please. And another thing that influenced people's decision-making was facts and what they believed about vaccines. We saw from the charts that George presented that many vaccinated people did believe that the vaccine, we asked about people if they thought the vaccine was safe and effective in a different question from what influences them. And we found that many vaccinated people believe the vaccine is safe and effective. And also the unvaccinated people had strong beliefs, and they had been doing research and reading about it. And some of them thought that the danger had been exaggerated, and both vaccinated and unvaccinated were concerned about vaccine safety, particularly when they were thinking about children getting the vaccine, and also the circulating misinformation. You can see there's several quotes from respondents about the misinformation and about what might be happening. And by the way, if you see the exclamation points or you see all capital letters, that was pulled directly from people's filling out of the survey. Next slide. Principles and values also guided people's decision-making. And there are some quotes here about mandates. There were people who said that they really wanted the vaccine to be mandated. And for instance, that people thought that the messaging wasn't quite enough. They also had to be making it mandatory. There were some people who felt that vaccines should not be mandatory, and they gave the principle that the government should not be telling me what to do. which is something that you have probably heard. Next slide, please. And people also, access was also important for people. Unvaccinated people didn't mention it much, and you saw in the slides that George presented that they were not really saying that ease of access, convenient place was that influential for their decision, but the vaccinated were influenced by easy access, particularly being prioritized by age, family health status or occupation, or being able to get the vaccine somewhere convenient, like where they live or with their healthcare provider. Next slide. The final way that we've grouped these, the open-ended answers was collectivist. And that was the top response for the reasons why people chose to get vaccinated was to protect their family, friends, and the community. This one quote, "I felt that it is a very small price to pay for a healthy society." And a few of the unvaccinated people said that they were concerned about their family, and that is why they did not get a vaccine. This quote here is from a male who was concerned that the vaccine would cause side effects and that something would happen to him and he would not be able to take care of his family. So people on both sides of the vaccine decision were thinking about their family, friends, and the community. Next slide. And throughout the survey, people made specific suggestions. People talked about giving incentives for vaccinating. I think as the Umoja Mobiliser showed us, people said it was important to share successes and life-saving stories, to support church communities, send letters to people without internet access, put signs on business doors, and make sure that people know that the vaccines are free and that they are not linked to immigration status, do door-to-door outreach for people who are homebound. And some people said that they wanted the information to be clearer and simpler. They talked about conflicting information and being proactive in confronting and correcting misinformation. One of the quotes I would like to share with you was a woman who answered that she was very concerned about TikTok giving what she called brainwashing to teens to question the vaccine effectiveness. And we saw a few other people who were quite concerned about social media misinformation as well. Next slide. Conclusions. George, would you like to take this slide?
Sure, thanks, Liz. I think we kind of settled on these 5 points based on the data that we have so far. And we think we need to continue the work of building and growing trust with communities. And this is especially important for communities of color, Black and Latinx, who we kind of gave a spotlight to in this conversation. We think it's important to lead with evidence-based facts framed in ways people could understand while directly combating misinformation. So we have to take this fact-based approach along 2 prongs, giving people correct information and being very proactive in dispelling misinformation. We have to understand and appeal to people's values and principles and work through trusted messengers. We have to make getting the vaccine as easy as possible by taking down barriers. And then we have to leverage the importance of family, friends, and community, including faith communities. Next slide. And this is our acknowledgement slides. I shared this the last time. It's always important to give props to the people who are behind making this kind of work possible. And then to our last slide, it's just a a slide to kind of invite questions and to take us to a short discussion if we have time. Thanks very much.
Well, thank you both for doing this. We have time for one or two questions because we're looks like 6:33 and we still got a presentation from the DOOR program. Any questions for George or Dr. Make? Well, thank you all so much for the great information. Some of this confirms some of the things we feel like we knew, and I think there's also some new information there too that's a little bit more nuanced. So thank you both for this. Thank you for being patient with us to run this presentation across 2 meetings. So with that, let me turn this over to my friend Andy Nelson, who's going to introduce our next presenters.
Thank you.
Good evening.
Hey, Andy.
How are you all? It's great to see you all.
Buenas noches.
When we do our Zoom DOOR meetings, I usually have everybody come off the microphone and just say hello, just get your voice in the room. So feel free to do that if you want to. You don't have to. It doesn't have to. We could do it all at once. Just, hey, how you doing? It's good to see you. Nice to have you.
Hi, Andy. Cherry Land loves you.
Hi, Andy. So, very nice to.
Hi.
Hey. It's very nice in this world of electronic gizmos and whatnot. We get to have some humanity exchange. So thank you for doing that. You guys know about the DOOR program. You've been hearing about it. I know, and tonight we're going to hear from the folks who've been doing the DOOR program, going door to door and talking to folks. We're going to hear, we're going to hear from Alex Salcedo Lopez, who's with Cheryl Ward Ministries, and we're going to hear from Mercedes de la Torre, who's with Sugar Freedom Project. Before we hear from them, I just say, the theory of change, if you will, with the DOOR program, you all probably know, but it's sort of that minds can change when hearts are touched, is sort of one thing that we say. And that a one-to-one conversation with a neighbor, we hope matters at least as much as a social media post. And we make sure that our folks have facts, but we also, really the main thing that folks have is their story. And so we want to hear some of their story tonight. So 60,000 door knocks so far, about 15,000 conversations. And let's hear from some of the folks who've been having some of those conversations. Let me first present Mercedes de la Torre. Mercedes is going to be speaking in Spanish. So if you have not selected, if you don't speak Spanish and you've not selected the English channel, I want to make sure that you do.
Thank you, Andy. Yes, just a reminder to everyone, and please forgive there's a crying baby in the background. Please, everyone select English or Spanish. Thank you.
I'll be back.
And I want folks to know Mercedes stepped into this role about an hour ago. She's filling in. And so really, really appreciate her stepping up to do that.
Ya no escucho.
Okay, so
Are we okay with the Spanish? Or we,
I'm just double checking. So let's see, Maria, you're doing Spanish to English, right? Maria Robles.
¿Me toca hablar?
I'm hearing Spanish language.
Okay, buenas tardes a todos. Mi nombre es Mercedes de la Torre.
Momentito, Mercedes.
Yeah.
Okay.
Yes, so let me try this again. I was trying to update. Let's see. So I've got.
Okay.
I think. I'm sorry. I was just trying to move. Is Maria, are you able to move between the two? I apologize, everyone. I thought all I had to do was make.
Let me know when we're ready, Maria Robles.
Thanks.
Can you hear me now? Oh,
okay.
Yes, I can hear. Let's see. I've designated you Spanish to English.
Okay. And if I could just reintroduce, thank you for your patience, Mercedes de la Torre. Mercedes works with the Sugar Freedom Project, and it's one of our one of our door outreach groups. So Mercedes, welcome. I would like, if you'd
Buenas
like.
tardes a todos. Mi nombre es Mercedes de la Torre.
Sorry, has
Yo me
Mercedes
involucré en
selected
DOR
Spanish?
por una experiencia que tuve de un familiar que falleció.
Mercedes, ¿has usted, have you selected the Spanish?
Por COVID. Yo tengo español.
Thank you everyone for your patience.
Yes, thank you so much.
Good. We're
¿Puedo
doing, being
continuar?
able,
I'm still hearing her in the English
Ok.
channel.
Yo me involucré en DOR ya que tuve la pérdida por COVID. Cuando a mí me dijeron de DOR, cuando vi la oportunidad de informar a mi comunidad que era necesario vacunarse. Aparte de que también lo vi como una fuente de trabajo. Nuevamente reitero, lo vi como la oportunidad de informarle a mi comunidad la importancia era.
I'm very sorry, Mercedes. We continue to
Tuvimos
only
que
hear
estar
Spanish.
viendo lo que era la vacuna, tomar los cursos con DOR para poder explicar.
Creo que
Apologies. Mercedes should be in the Spanish. Mercedes should be in the Spanish channel.
Yo estoy en español.
My apologies, everybody.
Estoy en español.
Okay. And then
Yo estoy
Maria,
en el canal de español.
Maria Robles should be, okay, everyone's getting English translation on the Spanish
¿Puedo
channel.
continuar?
Yeah.
I apologize, everybody. We had literally practiced this today.
¿Puedo continuar?
Let me try one more time and then to manage, and then I will. Okay, that's my apologies. It's flipped. I don't know why it's flipped. Okay, hold on.
Well, Lauren, would it work if those of us who don't speak Spanish, we should be the ones apologizing, would it work for us to go to the Spanish button?
Yeah, I'm just not sure why it's flipped. So yeah, right now, all right. Yeah, I would say toggle between the two. I'm going to let it be, and I would toggle between the two options to get the language you speak. My sincere apologies for tonight. So, Maria Robles, let's see, could you speak? Yes, I can hear you. I can hear Maria Robles in the English channel. And then Mercedes.
And Mercedes can continue.
Bueno, bueno, pues se me fue en qué estábamos, pero bueno, sí, bueno, el estar trabajando, el estar participando en DOR, dando la información de casa en casa, el hablar con personas de persona a persona, fue una experiencia muy buena y a la vez triste porque también encontramos a mucha gente que no estaba vacunada. Eso nos hizo a todas mis compañeras, a mí, ver que teníamos que hacer más por la comunidad, teníamos que recorrer más calles, más casas, hablar con más personas. No estábamos, yo lo trabajé como que éramos alcance de un 80-20, porque era escuchar a la comunidad, escuchar a las personas y posteriormente nosotros darles un poquito de nuestro testimonio. Sí tuvimos muchas personas que no estaban vacunadas, pero que también muchas personas de ellas tuvieron el interés de decir, sí nos vamos a vacunar. De igual manera, tuvimos a muchas personas que nos decían su experiencia en cuanto sus familiares, sus hijos no se querían vacunar porque sentían que era un chip. También tuvimos que dar una hoja, un volante donde decía lo que eran ¿cómo decir? Ay, se me fue la palabra. Se me fue la palabra, perdón. Bueno, les repartimos volantes donde les informábamos lo que eran los mitos, esa es la palabra que yo quería decir, los mitos. Varias personas nos agradecieron mucho el trabajo que estábamos haciendo y la importancia que era para nosotros la comunidad. Nos felicitaron en muchas ocasiones por el trabajo que estábamos haciendo, por el labor que estábamos haciendo. Reitero que las personas nos dieron nos dieron sus testimonios en cuanto que sus hijos no querían las vacunas. Sentían que era un chip lo que les estaban poniendo y que ellos no querían ser controlados por el gobierno. Al darles nosotros las hojas a los familiares, algunos de ellos sí nos dieron su número de teléfono para continuar tratando de ver si nosotros les podíamos hacer su cita o si querían que se les apoyara. Esto me hizo ver una visión grande para mis compañeras y para mí, el ver que podíamos seguir participando y ayudando y diciendo lo que se podía hacer y ver los logros que podíamos tener con las personas en cuanto a las vacunas y que mucha gente sí nos decía que sí se iban a vacunar y nos pedían la información. Entonces, eso fue muy agradable para mí, fue un orgullo para mí, para mis compañeras, el ver que podíamos lograr que varias personas de todas las que no estaban vacunadas se pudieran ir a vacunar. De hecho, hay algunas a las cuales yo tuve comunicación con ellas y me mostraron que sí se fueron a vacunar y eso alegró mi corazón, porque eso quiere decir que nuestro trabajo sí tuvo fuerza en cuanto a eso. Y pues yo quisiera decirle a toda la gente que vida solo tenemos una y que tenemos que valorarla y quererla y que eso es decirle un sí a la vacuna, un sí a proteger a nuestras familias, un sí a la vacuna, nuevamente reitero. Y la felicidad que tengo es que sigo en comunicación con 2 o 3 personas, dándoles ánimo a que sigan, ya tuvieron sus vacunas, ya solo estaban esperando que la vacuna fuera para sus niños menores de 5 años o de 5 años hacia arriba. Eso me alegra y estoy muy contenta y quisiera seguir trabajando, ¿verdad? Si tuviéramos la oportunidad, seguir en el proyecto de alcance hasta donde podamos a completar a que toda nuestra comunidad esté vacunada. Yo quiero agradecer a DOR por esta oportunidad que nos dio, al condado de Alameda que nos dio la oportunidad de hacer este alcance con toda la comunidad. Yo quiero decir gracias por permitirnos participar y que nos permita seguir en nuevos proyectos para la comunidad. Muchas gracias.
Thank you, Mercedes, and much appreciation to you for filling in and for putting up with us as we struggle for language and language justice. I would like now to introduce our next esteemed panelist, Alex Salcedo-Lopez. Mr. Salcedo-Lopez is works with Cheryl Ward Ministries. I see you, Reverend. It's good to see you tonight. And I want to welcome Alex. And Alex, I have some questions for you. Is there anything you'd like to say before we start?
start off, I was not well. I was working with my dad for the moment, and they really didn't work out because at a point I didn't see much progress going through there. So I instead got out of that job, and I was in the look of a job, and I couldn't find exactly a job to that will actually suit me, that I will actually like. And then my friend, she gave me the idea to apply for door, and I got interested because it informed that we would help out with the community and people with vaccination and testing and give out information, which pretty much got me interested. Because me, from my mindset, I always wanted to find ways to help out the community if it meant in any way. And I got this opportunity, and I appreciate the person that actually opened the door for me, because it feels good inside when you see that you're the one that's helping out people with information, or the smallest things that people appreciate is information that can actually help them and their family. And for me, it's pretty nice, a good feeling, because when you see a whole lot of people that look at you with that look that you are a person that wants to help them and that wants to enlighten their future by seeing you work hard, people get enlightened, and they say we can also help. We can find ways to help out with the community too. And with the door community, it's pretty helpful, and I appreciate my entire team and everyone that has support, because without them, without team, to be honest, nothing can be succeeded without team. It's all mostly on the team. Everyone puts in the part. I learned a saying that when you are by yourself, you're moving a house. You're moving into another house, and you are gonna take out a couch. Not one person can do it by themselves. It has to take 2 to 3 people to do it. And which really motivated me to find ways to work with others and be more social with people. That way I grow a bond with the community and say, you know what? I'm gonna do my part and help out as much as I can so I can see other people happy and living their life the fullest and healthy. And it's an experience that makes me proud of myself, because I've seen a lot of people get vaccinated and get tested, and it's amazing because there's a lot of rumors that the vaccine really doesn't work and that it's a way that people can get manipulated by the government, and I do not clearly believe that. I got motivated when my dad actually got infected with COVID, and he was in bed for 3 weeks, and we couldn't really see him at that time. And it kind of pushed me to get the vaccine because I wanted to be safe around people and keep people safe that were around me. And I feel fine. I felt fine when I got the vaccine. It didn't really get me sick. It just gave me a sore arm, and that was it. And I honestly see a lot of people in the community that offer their help in many ways, and it's pretty amazing. The numbers have went up with vaccination and testing, and it's pretty impressive. I'm honestly glad to be a part of the team. And the advice that I would give for people that want to make their own door program, I would say that if you want a program that will be for the community, it would be best to see a team that will work together as one. A team is separate, is different. They all know ways to work. But when a team works as one, anything is possible. And I truly believe that. And I have faith that whoever wants to make a door program, they can do it.
Thank you, brother. That was really beautiful. Really well said and really beautiful. I really want to express my gratitude for you, the Sugar Freedom Project, for Reverend Cheryl Work Ministries, and all of our door panelists and door knockers and door teams. So thank you, guys.
Thank you.
That's my part. I think we're about at time, so I'm happy to turn it back to Greg. I don't know if we have any time for questions.
Let's see, yeah, we got time for one or two questions. Anybody got a question? First of all, thank you everybody for your patience. Thank you, Spanish speakers, for being patient with us, monolingual English speakers. It's on us not to know Spanish, I think, if we live in California. So any comments, questions? Again, thank you to folks from the door. Anybody? Oh, I see Almaz, you have a question?
Yeah, hi, my name is Almaz. I'm from Global Communication, Education and Art. Yeah, I just, this presentation in Spanish was very good. I really appreciate it. And just something that I observed from the previous presentation in general was like, you know, it focuses on the faith-based community, but also like it's under, you know, from the Alameda County, because they're just not really, you know, showing that they, nonprofit organizations, grassroots organizations who are doing a great work, because they are also a trusted messengers in the community, because you definitely need to really admire that, like our organization, the street level health, other organizations who's doing great work on the community. They are the link, especially for immigrant populations with language and system barriers. We are the, you know, the link for that, because even though we do work with our faith-based communities, like the church, the mosques, and other groups. However, without, you know, us being there, like, you know, we cannot even bring the county to that church, because we definitely have to really work together, as a brother was saying, like definitely teamwork, like all of us together. But we need to admire and acknowledge the grassroots organizations are doing amazing work, not only for vaccination, but also like food distribution and any other mask distribution, and then hand sanitizers, all this, you know, information given out to the churches, because without ours, the church cannot also be accessed, because we work together. Like, for example, we have brought Omaha Health or Alameda County testing to our site, to our churches. So in the previous research and then surveys, I see that misinformation about the trusted messengers also should be the grassroots organizations who's participating in the community. What else? I think other than that, that's what I wanted to mention. Thank you so much.
Cool. Thank you for that, Almas. I think we're just about at time. Any additional announcements? Anything? Oh, I'm sorry. We got one more question. Sharon, you had a question or comment? And Cheryl Ward. Let's take these last two and then we'll close out. Sheridan and then Cheryl.
Hi, thank you, Greg. I'll be quick. Just two quick, a question and an announcement. I'll start with the announcement, which is the State Council on Developmental Disabilities continues to have a partnership with California Office of Emergency Services. And if there are any community partners out there, organizations, community groups, advocacy groups that are serving people with disabilities and need access to PPE, surgical masks, N95s, gloves, sanitizer, gowns, any of that, please reach out to me and let me know so I can help you get those at no cost and talk to you about that opportunity. The second announcement, and I'll put my email address in the chat in just a moment. The second would be a question is we're communicating with the Department of Public Health at the state level, and they are considering a pilot project that would provide 6 weeks of COVID testing in a kit for people that do not have access, don't have easier access to other testing sites. So the pilot that they're working with us on is so that these kits, these total of 12 COVID tests for 6 weeks of testing, 2 tests a week, would be going to caregivers and direct service professionals or parents or family members that are caring for people with intellectual and developmental disabilities or other people with significant disabilities and have more issues getting tested regularly. And of course, that would be for vaccinated individuals or people that are not vaccinated. If you think you know of any populations that might be interested in that, please reach out to me. I'm also curious if there's other populations outside of the disability community that might be interested in a pilot project like that to get kits of 12 COVID tests that would then, the recipient would need to upload those online, either using their cell phone or some other way. Anyway, wanted to share that. And if there's any community partners that have questions about that or want to give feedback, or if you'd like to order PPE, please feel free to reach out. Thank you.
Cool. Thank you for that. Cheryl, Reverend Cheryl Ward, how you doing?
Good, good, good. Thank you all for the presenters today, and especially the young people. And I just wanted to say something to you all about Alex, is that Alex came in day one working. He's a hard worker. And I was just impressed by him day one. It's like whatever needed to be done, you didn't have to ask him. He was just on top of it. And he's not afraid to talk to strangers, and he's been one of our best outreach workers. So I just wanted to share that with you all, and I'm proud of him for presenting tonight. And he had no hesitation when I asked him. So great job, Alex.
Thank you.
Cool, thank you. I think that's it for the evening. We're right at the top of the hour. I want to thank everybody on behalf of Nestor and Kimmy for being here tonight, for all of the hard work that we're doing to make our community healthier and safer. So thank you all very much. I think the last thing is our next meeting is scheduled for December 14th. And we're going to ask you the question of whether or not we should meet on that day, since it's getting close to the holiday period. Just like if you could indicate in your box, like if you would think we should meet, maybe just raise your hand. Use the hand raise icon, and we can get a sense of how many people we'll have. And we may just poll you with the email as well. But just give us a sense. Do we want to meet? Folks raise their hand. If you do want to meet on the 14th, just raise your hand. Let's see. Looks like, boy, it ain't a whole lot of people. Maybe it's the Zoom fatigue is kicking in. But tell you what, we got some sense of that. We'll send out an email and poll everybody, Lauren, and then we'll get a sense of how many people we'll have on the 14th. And if not, we'll see each other in the beginning of the year. I think that's it. Lauren, any other announcements? Anything else we need to say this evening?
I think that was it. Thanks everyone for your patience. I apologize for all the technical.
That's all right. It happened. Smile, mommy.
Par for the course.
Smile. It just happened.
Está bien, no pasa nada.
Yeah. All right. Thanks, everybody. We'll see you next time. It's all good. Nothing broke.
Thanks all.